space for conversation around women's health through the lens of naturopathic and Eastern medicine. I am Sandy Ross, and this is Her Earth Medicine Podcast. This podcast is multi-leveled. Episodes for patient education to graduate practitioner level. Thank you for tuning in, and I hope you gain value from this episode. Hi guys, and welcome back to the Her Earth Medicine Podcast. Today we're going to be discussing nutritional psychiatry for depression with Jessica Bays. Jess is a Ph.D. candidate at the Australian Research Centre in Complementary and Integrative Medicine from the University of Technology in Sydney. Her research interests include dietary interventions for mental health, and she is currently leading a trial testing the effects of the Mediterranean diet for improving depression symptoms in young males. Jess also works as a nutritionist in her own clinical practice, where she sees clients face-to-face and online. Let's dive in and discuss all things depression with Jessica Bays. Welcome to the podcast, Jessica.
Thank you for having me.
Thank you so much for joining us, Jess. Can we start by hearing a little bit about your journey and how you became fascinated to do research in nutrition and the role of depression?
Yes, that's a really good question. So as soon as I started my nutrition degree at Endeavour, I was in love, found every part of it fascinating. And I remember people sort of saying, you know, you've got to find a niche, and that really stressed me out because I thought, but I love every part of it. I can't possibly find a niche. But then as I went on, mental health just kept calling out at me. I think a lot of people find that from their own experiences, you know, if they suffer from a certain condition themselves or family members or friends, you know, you take a bit of extra interest in those areas. And I remember in general just really being, I guess, disappointed with the lack of research in natural medicine as a whole. So many assignments, or when we were in clinic, being asked to provide evidence for certain recommendations, and just not being able to find any of that research or good quality research that was in humans, that wasn't just in animals, and just feeling really driven to do something about that, to change that. So I think I knew from about halfway through the degree that I really wanted to pursue research and contribute to, you know, progressing and moving forward our industry, and giving it a bit more credibility. And when I finished the degree, the honours program was being offered, and I thought, yes, definitely I'm going to do that, and absolutely loved it. I mean, it was the most difficult thing I've probably ever done, but I'm so grateful that I did it. I had some amazing supervisors who are just like my idols, and watching them and their careers and what they've done, I just thought, yes, I want to do that. I want to be like them. And after finishing the honours program and that research, my supervisor said to me at a conference, okay, when are you doing your PhD? Let's make this happen. And she sat me down and we had lunch and we sort of brainstormed, you know, what can you do? And she's like, okay, what are you interested in? What do you care about? What would you want to do? Who would you want to help? And that's how we found our way to what I'm currently doing, which is looking at nutrition interventions for depression.
Amazing. That's such great inspiration, and it's lovely to hear that you went straight from being a student into research too, because I think in our field many people get out there and spend a few years before they can really find what they want to do. So that's amazing that you were able to just get on that journey so quickly and follow it straight after studying your degree into your honours and then straight into a PhD. So well done to you. Okay, so let's chat a little bit about what is nutritional psychiatry and the role it has in mental health.
Yeah, so that term is only quite a recent term, and it's a really new field, quite in its infancy. But it kind of makes sense. It's sort of common sense that, you know, how we eat and the foods we eat affect our mood. I know that nothing lifts my spirits more than a nice cup of tea when I'm feeling down. Most people, after a night of drinking or binge eating generally feel a bit rubbish the next day. So it's kind of not this really radical new idea, but it's only been researched sort of more seriously over the last sort of 10 years or so. And now it's sort of booming. There's so much research in it now. So nutritional psychiatry looks at different individual nutrients, specific foods, as well as whole dietary patterns and the impact that these have on mental health. And that's been termed nutritional psychiatry.
Thank you for clarifying that. I attended the International Congress on Natural Medicine a few years back, and it was on functional psychiatry, I think it was. Did you attend that?
No, I didn't. I had a conflicting thing at the same time, but I wish I was there.
It was fantastic. There were some amazing researchers, academics, many medical doctors coming from California and psychiatrists and everything like that. And that's where I sort of was hearing the new term about nutritional psychiatry, and it's so interesting, and it's definitely something that I think people are taking a big interest now. Even psychologists and psychiatrists too are taking a huge interest in it, and I just think it's such a great area to spend some time researching. So can we talk a little bit about therapeutic mechanisms and the role they have in depression?
Yeah, absolutely. And just before I jump into that, you just said something that made me think of a recent research paper that's just come out it interviewed psychology graduates about how confident they would feel talking about nutrition to their patients and how much training they get in it. And the results were basically none, and that they don't feel very confident doing that. So I think that's really interesting to see from the psychologist's point of view, that they wish they had more training in it, and that's definitely where, it's what we do, as nutritionists and naturopaths. So I just think that's really interesting that they're starting to look at, really integrating nutrition into psychology programs now. So anyway, I'll jump into those mechanisms. Yeah. So quite often people say, oh yeah, that's really great, diet for nutrition, but how does that work? Like how does a food actually impact our mood? Now, we still don't really know exactly what causes depression. And there's lots of research going on about different potential mechanisms, and genetics and evolution and all these sorts of theories around why people get depressed. But we do know that it's a very complex illness, and with lots of different potential mechanisms and bidirectional pathways of different things going on. And we know some of the main ones implicated with depression are the role of inflammation, oxidative stress, epigenetics, mitochondrial dysfunction, the role of the gut microbiome, so the bacteria that live in our digestive tracts, the role of the tryptophan, kynurenine pathway and metabolism, as well as the HPA axis, which is to do with stress and cortisol, as well as something called brain-derived neurotropic factor, which is to do with plasticity in the brain, and also the role of obesity as well. So they are just some of the many different mechanisms and pathways of which we hope that can be influenced with nutrition, with foods, with supplements and whole dietary patterns.
Well, it certainly is multifactorial, isn't it, depression? I think that's why NATs and nutritionists can really work well alongside treating patients, supporting patients with depression, because we do take into all those factors. And maybe we'll come back to the role of the mechanisms in a moment, but can we maybe discuss what is the monoamine hypothesis and the role it has with the chemical imbalances in the brain?
Yes, so a lot of people that suffer from depression or know someone that has sort of heard the term chemical imbalance sort of floated around. And this was sort of to do with the accidental discovery of antidepressants and how they worked. It's to do with a study for a drug to do with something completely different, and they noticed that it made the patient's mood improve quite significantly. And it did this by increasing the availability of certain neurotransmitters, particularly serotonin and noradrenaline and neurotransmitters implicated with mental health. So there was this idea that if these antidepressants worked by increasing the availability of these neurotransmitters, that people that suffered from mental health conditions like depression must not have enough of these neurotransmitters. There was an imbalance in the amount that they need and the amount that were exerting a therapeutic action. Now, this was just a theory, and we can't actually measure to see if this is the case. We can't take a depressed person and test how much serotonin they have and if they are deficient in it. So it's got quite a few flaws with that theory. And because of that, it's starting to fall out of favour a little bit, particularly because a third of patients don't respond to antidepressant medications or become resistant to it. And the fact that antidepressants seem to work for anxiety disorders as well, and certain drugs which decrease serotonin have been shown to be helpful for depression as well. So there's lots of conflicting things going on there, which have kind of made that theory kind of fall out of favour a little bit. So that's why scientists are really starting to look at other things that we can approach, other theories, other mechanisms, like some of those that I mentioned before, particularly the role of inflammation, oxidative stress, and things like that.
Okay, great. So that's a great segue to come back to your therapeutic mechanism and talk about perhaps neuroinflammation, because I think that's one area I'm so fascinated in, and I found actually very good results when treating patients with depression with that approach.
Definitely, yes. It's a very exciting area.
Yeah, so could you maybe elaborate a little bit about the role of inflammation in depression?
Yeah, so research has shown for a very long time that increased levels of inflammation are associated with mental health conditions, particularly depression. And this is something that's quite easy to measure. So usually when people think of inflammation, they think of maybe a cut on their knee, and they think of pain and heat and warmth and swelling and things like that. But that would be localized inflammation. You can have systemic inflammation or inflammation in the brain, like that neuroinflammation that you mentioned. And we can measure this through biomarkers on a simple blood test. So something like C-reactive protein, which is a very simple, easy blood test that you can do, can measure markers of inflammation in the blood. And it's shown quite consistently that those suffering with mental health conditions have these increased levels of inflammation markers. And inflammation is something that we can modify. We can take anti-inflammatory drugs, but diet is also a really modifiable thing that we can do to modify and exert a influence over systemic inflammation. So, anti-inflammatory diets like the Mediterranean diet, or anti-inflammatory nutrients like omega-3 fatty acids, things like that, can have a really significant effect on that inflammation.
And do you also use botanicals as well, anti-inflammatory botanicals?
Yes, so things like different herbs and spices, so turmeric, saffron, all those sorts of things. And more and more research is coming out about them, which I'll talk about a bit later. But great. So there's lots of different things that we can do, definitely.
Yes. Okay, great. I love the Mediterranean diet, and I certainly love using those botanicals. Okay, can we maybe touch on, and I know all the naturopaths are going to love to listen into this, the role that the microbiome has in depression?
Oh, I love talking about the microbiome. So the microbiome, for any listeners that are maybe new to this, is the good and bad bacteria that live along our digestive tracts. So you might have seen adverts on TV for Inner Health Plus and things like that, and probiotics or cultured yogurts like Yakult and things like that, and being told that that's really important for our gut health. And generally, whenever anyone talks about the microbiome, they're talking about digestive-related issues and things like that. So, eating fermented foods or taking probiotics for irritable bowel syndrome or Crohn's disease or intestinal permeability, otherwise called leaky gut, and things like that. But the idea that our microbiome can affect our mental health might sound a bit crazy to a lot of people. But we know that our microbiome is responsible for so many functions and physiological changes in our bodies. We know that our gut microbes are responsible for making 95% of our serotonin, for example, which shocks a lot of people. You tend to think of serotonin, this neurotransmitter, being located entirely in the brain. But our gut bacteria help to break down and make certain metabolites and things like that are used for these neurotransmitters. We also know that there is a bidirectional pathway called the gut-brain axis, which is this link between our brain and our gut. Again, our microbiome plays a huge role there. As well as, really making sure everything is working properly, making sure our intestinal lining is strong, that things don't get through into our blood that shouldn't, a whole number of different things. And so much research is coming out now, almost a paper a day, about the different wonderful things our microbiome can do. It's almost being considered this whole other organ with the amount of different functions and things it can do.
Yes, definitely. And so it's 90 to 95% of serotonin production, is it? Okay, because I've heard many different statistics around that, from 70 to 80 to 90, but that's great to hear from you. 90 to 95% serotonin is produced in the gut. Are you using much microbiome testing in your clinical practice?
No, and that's mostly because the research is still in its infancy, particularly around particularly when it comes to probiotics. Mm-hmm. It's not conclusive, as in this particular probiotic is definitely helpful, or this one is unhelpful. We know sort of generalizations. We know that, for example, the bacterial colonies in, say, vegetarians are very different to that of meat eaters. And we also know that it only takes about 24 hours from changing your diet before the colonies and types and species of bacteria will change after you've changed your diet. So we know that changes quite quick. We know from lots of animal studies of putting the transplants of depressed mice and rats into non-depressed mice and rats can then make them depressed. So there's lots of research sort of showing these sorts of things, but there's nothing really conclusive enough to say you need this specific type or not this specific type of bacteria. It's still in its infancy. So I don't tend to do too much testing. I tend to ask, and also tests are really expensive.
Yes,
particularly if you're doing it through an app and things like that. So no, I don't do too much testing. I tend to ask more sort of diagnostic questions, and for now, I tend to go down the route more of trying to get patients to include fermented foods and things like that, rather than play around with specific probiotics.
Yeah.
Just because I think we don't know enough to make any specific, take this exact strain, this exact amount. Yeah.
Okay, interesting. I was wondering if perhaps there was any potential findings with opportunistic bacteria and depression and stuff like that. So, parasites, bacteria, virus, yeast and all that sort of stuff. Because I find a bit of a correlation, particularly in the IBS patients or SIBO patients and stuff like that, how it affects their mood. But we know that's, I guess, all interconnected with how the gut absorbs everything and delivers their nutrients to their cells and whatnot. And I guess being an advocate for the Mediterranean diet, that's quite rich in pre and probiotics anyway. So, and sometimes it is when you look at a lot of stool tests, you're kind of saying, you need to eat more fibre and, this kind of diet is going to be rich in fibre and that's therefore going to support your gut bacteria. So sometimes I think testing can be overused and diet is totally underused in these areas, especially in depression. And the fact that the bacteria change so quickly, like that's so fascinating, isn't it, to hear that in one day you can actually change the diversity of your gut bacteria by changing your diet. Like that's amazing. People need to really let that sink in.
Definitely. It's such a powerful tool. It really is. And you're absolutely right. There is a huge correlation between IBS and people that have those issues and depression, particularly IBS. And we think that there's a really strong link between IBS and serotonin, and things like that. So that's really interesting as well. But it also comes back down to those mechanisms that I touched on before. Inflammation, oxidative stress, leaky gut, all those sorts of things.
Yeah, totally, definitely. Okay, so maybe we can chat a little bit about the role that vitamins and minerals have in depression.
Yes, so these are much easier to research because you just take it as a tablet, you take it as a supplement. It's almost like drug trials, as in you can have placebos, you can have separate groups, they don't have to really do too much else other than take that tablet. So a few studies have been done, good randomized control, double-blinded, placebo-controlled. However, they still get mixed results. Some have shown more conclusively that they can be really beneficial for depression. So certain vitamins such as folate and B12, particularly in those that were low or deficient, that can be really significant for mental health. So if you're suffering from depression, it's always worth getting your folate and B12 checked through a blood test. Vitamin D is another one. Again, in people that were low or deficient, that can make a really big difference as well.
Yeah.
Iron and zinc, in terms of the minerals, are the two, again, in people that are low, that can be really significant. So testing your iron is always a good thing to do, particularly as women. That's really common to have deficiencies, even if you're eating a lot, even if you're taking supplements. Some people just do not absorb iron very well. So they're really important ones to look at. But some studies don't really show too much of a difference. Now, that might be because the participants already had pretty good levels of them, so that wasn't a contributing factor to their depression. Lots of these studies were quite small, so the sample sizes weren't very big, and other sort of issues like that. And then there's also the fact that usually we don't take isolated nutrients by themselves.
Yeah.
They need to interact with the other foods or the other compounds within a food. And that might actually be what's giving those nutrients their therapeutic effect, is when they're working in tandem or in combination with the other nutrients and bioactive compounds like polyphenols and antioxidants and things like that all bolster each other up. So we know that certain B vitamins work best with other B vitamins. So it might be that's the case, which is why there is a push for looking at more whole foods and dietary patterns.
Is there correlations between, I guess, fatty acids, essential fatty acids, in particular EPA and DHA, being used together rather than isolated as just potentially DHA for depression?
Yeah, so most studies on omega-3 fatty acids will include both EHA and DHA, and some even will have some of the plant-based as well. I know that, there's a lot of talk when you're studying nutrition about the correct ratio of them, and, we get quite drilled in with the very specifics of those sorts of things. So far, the studies looking at omega-3 fatty acids have been very positive, showing that it helps. And one of there have been two main really big studies that have looked at a Mediterranean diet for depression, and one of them used a Mediterranean diet plus fish oil, and that found to be very effective. So for that one, it's more conclusive. I'd say omega-3 fatty acids are a great thing to add into your diet where you can. In terms of research that's looked at just DHA or just EPA or combinations of the two. I don't know of any studies that have done that specifically. There might have been studies done like that in terms of looking at general bioavailability and effectiveness for other things, but I don't know about mental health specifically.
Okay, yeah, because I know there's a lot of research around fatty acids in particular, and if someone was to maybe include more fish in their diet to try and support depression, do you have any idea of what the guideline is to be able to try and reach those measures they need, the therapeutic dosing for fatty acids in the diet?
Yeah, so generally, I think it depends what kind of fish you're eating.
Yes.
And it's very hard to test each individual fish. So it's going to be variations depending on where it has been sourced. If it's factory farmed or ocean, the type of fish, the size of the fish, the diet of the fish. So many different things play a role here. Generally, when we're talking about depression and trying to increase fish to get those essential fatty acids, we would recommend to have it sort of 2 times a week as a minimum.
Yeah.
And there's certain seafood that's higher in essential fatty acids. You've got your salmons and things like that. But when it comes to depression and trying to make some dietary changes, it's all about working with that individual patient. A lot of patients don't like fish or seafood or are unfamiliar with cooking it and preparing it, or cost is an issue. If you have no energy, you have no motivation, you struggle to even get out of bed, it's good that some studies have shown it to be effective from supplement, because I think that that's a really good starting place for people that, would have no idea what to do with a piece of salmon, cannot afford it, and don't really like the taste of it. So it's good that we do have some of these isolating nutrients that we know are effective as a supplement. Whereas some of the others, it would be better to try and get through food sources, such as some of those other ones.
Okay, and in terms of supplementation, do you think that the quality of the fish oil is very important too? Because I do understand that it can oxidize very easily, the fatty acids. They're not very stable with heat, and there's obviously a huge range on the market, and it can go from $10 for 200 capsules up to $50 for 60 capsules.
Yeah, so really good question. You do get what you pay for, definitely. I again work with the patient. If cost really is an issue, we try and find the best possible brand we can find on a budget and things like that. I'd say, where you can, if you can afford to get better quality, practitioner, FDA approved, supplements, go for it. If you're, really struggling, maybe you've lost your job because of COVID, you're on Centrelink, or, you have no energy, no time, and this is causing you stress, thinking you need to get the very best fish oil supplements. I don't want to cause any more stress to your life. It's okay to do the bare minimum to get through. And I really want to stress that, there is this, I think this pressure amongst natural health practitioners, that everything has to be organic and everything has to be, local and seasonal and from the health food shop and has a low carbon footprint, and all these criteria that can become really overwhelming for the everyday person. And particularly for mental health conditions, for depression and anxiety, when everything feels overwhelming anyway, when everything feels difficult and too hard and you just want to sit and cry, do not stress about things like that. Just do what you can. So I just want to stress that as well.
Okay, good. Thank you for clarifying that. And I guess I was sort of thinking a little bit around the role of potentially, hemp seed oil or flaxseed oil potentially as well. And that's why I sort of asked a little bit about DHA, because I know the conversion from flaxseed oil can not be so great in DHA, but however, you get a lot of EPA. So I suppose if you're looking at depression from that neuroinflammatory component, then the EPA will be really supportive. If it's, DHA is necessary, then maybe not. But it's great to hear that you think do your best, and if you can get a supplement that's going to work for you, then you do so at the time. If you can get the best quality, I'm obviously an advocate for very good quality as well, as being a naturopath. I always try and get my patients to keep fish oil in the fridge as well, because I always think if we keep a fish out on the bench, it's going to go off and go smelly, and I think the oil is probably very similar too. And even with things like the hemp and the flax, I always recommend keeping them, out of the heat and in the refrigerator if possible, because they're a great source of those fatty acids. So moving on, can we discuss the role of herbs and spices in depression?
Yes. So this is really exciting. I mean, I think in the natural health community, we just love turmeric. Is there anything turmeric cannot do? I mean, it really is this hero spice. It's something you can easily add to everything. And so many studies have shown it to be really beneficial for depression. So you've got the active component of turmeric, which is curcumin. And I included a lot of studies with curcumin in my literature review I did at the end of 2019, which was on different polyphenols. So I picked all different ones like resveratrol and red wine, and different polyphenols in like lemon and citrus and coffee and soy and all sorts of ones. And one of the standout polyphenols was curcumin, so turmeric. And these were mostly taken as a supplement rather than added to food or in a special drink like golden milk, used in traditional Ayurvedic medicine and things like that. So that is something you can take as a supplement. Now, interestingly, not all of the studies that tested curcumin used black pepper in their preparations, and we know that pepperin in the black pepper increases the bioavailability of the active compounds. So it was interesting that they didn't all do that. I think half of them did, half of them didn't. But still, despite this, the overwhelming result was that it is very supportive and great for mental health. So definitely add this wherever you can. But this is all your cooking, all your drinks, all of your... I just put it in everything. So that's a really good one. The other herb that has been studied more extensively is saffron. I actually was invited to peer review a few papers on saffron supplements for mental health, which I found so interesting. I love peer reviewing because it means you get to read the fresh new research first. Right. So I was very excited by that. And yeah, more and more studies are coming out really showing this to be another hero spice. Now, obviously, saffron is quite expensive. You can't go around adding a ton of saffron to all of your food. That will break the bank. But again, there are lots of supplements now which combine both turmeric and saffron. So I know that there's a bioceuticals supplement that combines those two, which is aimed at mood. And there's quite a few others that do that as well now, which is really exciting to see.
And I've looked at some of the research with saffron and mood and depression too. And for a herbal, you only need a very low dose too. So although it is quite costly, you actually don't need that much to get that therapeutic range. So which is great for naturopaths to be able to prescribe it. And just a little hack on the turmeric. When you said they are supplementing, is that because it's quite hard to reach the therapeutic range in the dietary intake? Because I know I think it's 25 milligrams a day that they were looking at, which is a lot of turmeric to consume unless you are having, diligency with your golden milk. But I found if you make a golden milk paste, so you get the fresh powder and you do it with the coconut oil, the pepper, a bit of ginger, it actually condenses really quite, it goes from being a big bag of powder down to a small amount of paste. And then you only need 2 teaspoons to reach that 25 milligrams. So if you have 2 golden milks a day, you actually get that 25 milligrams of turmeric in your diet. So that's a really easy hack to try and implement into someone's diet, is have a morning and evening golden milk. And because I know supplementation can be expensive, and that's a very cheap. You can get a bag of organic turmeric for I think $35 online with Astral Herb, and so I have a lot of people make them up instead of having to do the supplementation, and I find that's a really good hack there, because I think that was one of the things with the researchers, they couldn't get the daily intake unless they're consuming huge amounts of it, which is hard to do.
Exactly right there. You hit the nail on the head there. That's exactly why they did it in a supplement, because it can be so hard to get that much. So for people that like the taste of turmeric, definitely do that hack. That's a great hack with the golden milk. A bit trickier for people that don't like the taste. But there's ways to work around that with your health practitioner. But yes, definitely.
I love it, and I actually don't think it tastes turmeric-y at all. I think it tastes, if you use the right nut milk, or if you mix it in coconut milk or something like that, I find that the taste is very pleasant. It smells very curry-like, but not so bad when drinking it. And it's really lovely, especially coming into the kind of cooler months here in Australia. Okay, can we maybe chat a little bit about the dietary patterns and the role they have in depression?
Yes, so we've touched a bit on those individual nutrients and why some of those studies might not have showed a favourable result, because they were taken in isolation. So when we look at foods taken together as part of a dietary pattern, this could be a lot more effective, because that's how we eat. We eat foods all together. We eat a variety. However, dietary pattern research is really tricky to do. So most of it is observational. So most of it is looking at certain populations that eat a certain way and looking at the prevalence rates. So how many of that population end up developing depression or other mental health conditions, or if certain things they're doing in their diet are protective against developing depression. So traditional diets generally show reduced depression incidence. So we're talking about the traditional Mediterranean diet, we're talking about traditional Japanese diets, Norwegian diets, any traditional diet really. And we also know, unsurprisingly, that the Western diet, which is high in sugar, salt, processed foods, processed meats, things like that, tend to be a risk factor for developing depression and other mental health conditions, rather unsurprisingly there. But when it comes to doing controlled trials and studies, it's very difficult to get people to completely overhaul and change their diet. There are so many different confounding factors. It's not like you just take a pill, it's a lot more tricky. So to date, there have only been sort of 2 or 3 studies that have looked at dietary patterns for depression. The first one was the SMILE study, which was done by the team at the Food and Mood Centre in Deakin. And they looked at a modified Mediterranean diet on the outcomes of depression in adults. And then there was also the Health for Med study, which is the one I sort of briefly mentioned earlier, which looked at a Mediterranean diet plus fish oil supplements. And both of these studies showed quite conclusively that yes, a healthy Mediterranean diet can help treat active depression. So we had lots of research that shows that it was preventative or helpful in reducing the risk. But these studies help show that it can actually reduce or reverse active depression. So we're talking about major depressive disorder. So that's been really encouraging, and that really inspired me to do the randomized control trial that I'm doing at the moment, which is looking at a Mediterranean diet in treating depression in young men.
Great. Can you maybe touch on what the Mediterranean diet foods actually include?
Yeah, so that's a really good question. So for research purposes, the Mediterranean diet is based on the traditional Mediterranean diet of the countries around the Mediterranean basin in the 1980s 80s, which is when they were first discovering that the people that lived in these areas were having reduced incidence of like heart disease, diabetes, and lots of other physical health issues. And that's when they went in and looked at exactly what components of the diet, how many serves of fruits and vegetables do they consume, how many serves of nuts do they consume. They use olive oil as their main source of fat. They drink red wine with meals moderately. And that's when they really characterized, what makes it different, and then started using that term to coin that diet in research. Now, I speak to a lot of people that are like, I follow a Mediterranean diet, just because they start the olive oil on everything. And I'm like, it's a bit more involved than that. So for the purposes of the research, it's high in fruits and vegetables, nuts and seeds. It predominantly focuses on white meat and fish rather than red meat.
Okay.
Includes fermented foods such as cultured yogurts, alcohol, that's a bit tricky, mostly red wine, sort of moderate, not like binge drinking, vodka cruises, just sort of with meals, and lots and lots of olive oil. So for my research participants, we get them to have 3 serves a day, which is about 3 tablespoons, which when you consider sort of cooking and things like that, it's easy. It's actually quite easy to get in, but at first sort of freaks people out a bit.
Not naturopaths.
Lots of different herbs and spices. Not naturopaths, but for anyone else listening. Lots of herbs and spices. And the one thing that I really stress to my participants and my patients is that it's not a weight loss diet. Now, I know the word diet often makes people think of reduction or calorie counting or salad. I prefer the term sort of Mediterranean eating pattern, because it takes away some of those negative connotations, because it's really about enjoying food. And there's lots of other, it's getting off topic a bit, but there's lots of other psychological benefits that come with preparing a meal and putting a bit of effort into what you make, and the feelings of satisfaction and taste and enjoyment, and all these other psychological factors that go into preparing a meal and sitting with your family and those sorts of things as well. So
yes. Yeah. My listeners know I'm a big advocate for mindful eating, and that we've really lost connection with culture and sitting down at the dinner table having conversations. Can I just ask a little bit about grains in the Mediterranean diet, and also legumes?
Yes, I did miss those.
That's all right.
So thank you. Lots of legumes. So legumes, beans, pulses. So we're talking about things like lentils and chickpeas, things like that are encouraged. So including things like hummus and falafel. Some of my favourite foods.
Yeah.
It is, when you look at the macronutrient distribution, it is relatively high in those complex carbohydrates.
Yeah.
I know a lot of people, it's one of their first questions, like, isn't that a lot of carbs? Breads and pastas, but we really want to focus on those whole grains. They're really high in B vitamins, folate, those things that I talked about right at the beginning, which are really important for mental health. But also the role of fibre. Legumes and whole grains are really high in fibre, and we know that is really important for our microbiome, which we have already discussed, and why that is so important for mental health. So really every component of the Mediterranean diet is high in all of those nutrients, and those components influences all of those pathways. So it's really just one thing you can do that really has a knock-on effect to so many areas and systems.
Okay, and just a quick question on the grains, and particularly focusing on wheat, because I know a lot of naturopaths are kind of advocates for the gluten-free diet, especially if we're looking at inflammation. But so I know wheat is a big component in the Mediterranean diet, but are they using particular, especially in the research, do people have to follow a traditional type of wheat? Is it fermented? Is it hard or a soft wheat? Are they using kamut? Or are they able to include Australian grown wheat crops here?
Yes, so that's a good question. Yes, and I know that like you said, a lot of naturopaths are very advocate for gluten-free and all those sorts of things. And yes, there is a difference between the grain here compared to that in Europe in terms of milling and processing and the types and things like that. So I guess I'll answer this in two parts.
Okay.
First, check in with the patient. If they have any kind of gluten sensitivity, celiacs, or a disorder that is exacerbated from gluten, whether that be a gut disorder or a learning disability or anything like that, obviously, you make modifications. You choose other whole grains like brown rice and things like that. But no, in the studies that have been done and in my own study, I don't believe they're not asked to consume a specific type of whole grain. They can have any kind of whole grains they want. So they can go and buy, we coach someone how to choose better quality wholemeal, breads and pastas and things like that. But no, it doesn't have to be any specific preparation at all. Does that sort of answer your question?
It does, and I guess it could open up a whole new can of worms, really. And I'm quite interested because I look at the role of the glyphosate and also the hybridized versions of wheat and the higher gluten that they consume, that they have in those crops there too, potentially. And I know that the European grains don't have them. I think it's now becoming something that's being allowed into Europe, but I think there's been a big restriction on their wheat and how it's grown and all that sort of stuff. So I wonder if it was a little kind of leeway into some potential more research on the role that might have potentially on the microbiome in the role of depression. But yeah, opening up a can of worms there for sure. So thank you for touching on that. Babbling on and digressing. Okay, so could we maybe touch a little bit about your previous research that you've done? Because I know you've done some stuff with polyphenols and you've done lots of surveying on the diets of young men. Can we maybe chat a little bit about this?
Yes. So my overall research topic is looking at a Mediterranean diet and if it's helpful for the symptoms of depression in young men. Now, like we've already mentioned, there are so many different mechanisms for how a Mediterranean diet might exert the beneficial effects. But I wanted to specifically look at polyphenols and the role that they might be playing. So I did a big literature review, which included, I think finally we got it down to, I think it was 37 papers. So polyphenols are compounds found in a wide variety of different plant foods. They have antioxidant and anti-inflammatory properties, and they're usually classed according to the nature of their carbon skeleton. So you've got flavonoids and phenolic acids and stilbenes and lignans, and they've all got weird names. But basically they're like antioxidants. And they may exert their beneficial effect by upregulating the body's natural defense systems, by stabilizing free radicals, reducing oxidative stress, as well as neuroprotective properties. So there's like a bunch of different things. So what did we find, basically, is what you want to know. We found that, yes, polyphenols do really help with depression in particular. Particularly polyphenols found in soy, turmeric, tea and coffee, citrus, and grapes through resveratrol. Not necessarily just red wine, but grapes as well. So a whole variety. And all of these foods, are found in a Mediterranean diet. So it shows that could be one mechanism that by which it helps. And then after I did that, I wanted to look more specifically at the diets of depressed young men. Now, so many studies have shown that men's diets tend to be, in general, a lot worse than women. Men are less likely to go on diets, to eat high fibre, they drink more alcohol. And we also know that in young men particularly, they're less likely to seek help for their mental health. They are, more likely to use negative coping mechanisms, less likely to seek help. So if we could change the diets of depressed young men, we can change the diets of anyone.
Yeah.
If we can change their diets, if we can help them. So we wanted to know a few things. We wanted to know what their current diets are like. So we included a food frequency questionnaire. We wanted to know if they notice a difference of their diet on their mental health. And most importantly, we wanted to know if they would be willing to change their diet if it helps their symptoms. And the overwhelming majority said, yes, my diet impacts my mental health. And yes, I would change it if it might help. And this is a group of 18 to 25-year-olds that have depression. And they're saying, yes, like it impacts me and I want to change it. So that was really great, because then that sort of gives me the go ahead to then do my study, to say, look, you know, they want to change. Because when I was first talking to people about my PhD project, they're like, look, that's great in theory. There's no way you can get a depressed young man to change their diet. You know, parents were telling me they can't get their sons to pick up their dirty laundry, let alone eat a healthy diet. They're like, it's not going to happen. But when we asked them, they said no, like, we're on board. Let's do this. So that was really good. And that then fed into this trial that I'm doing at the moment. I'm about halfway through, and so far the results are amazing. Like, so good. And it's so rewarding, you know, hearing these young men and their stories, you know, some of which, you know, had lost their job, wouldn't get out of bed, you know, and then they're sending me text messages saying, I applied for a job today, like, I shaved, you know, I went out and made a salad, and the difference it's making to their quality of life has been very rewarding. And I think if we can show that we can make this group, you know, change their diet and it works, I mean, we can help anyone if we can do that.
Oh, well done, Jess. That's just so nice to hear. What an impact you're making. Hopefully we can replicate this and pass the message on to young boys and really support them, because it is such a quiet space for them to talk about, you know, their mental health, and there's huge suicide rates, and we know how important the diet is, but it's not the mother also telling them about the diet. You've got a clinician, so I think it's coming from the right person in this circumstance as well. So good on you. Can I maybe just come back a little bit to polyphenols? Now, I'm a fan of polyphenols. I love the red wine, the coffee, the tea, green tea. I'm not sure if that's included because it's not part of the Mediterranean diet, but is there limitations on like quantity? So obviously if you tell a young boy, okay, you can have good red wine, are they allowed to have a bottle a day? Are they allowed to have a glass, like you said, with meals? And also coffee, because I know that can be another big one. They can also throw out their cortisol, increase anxiety. So are there limitations on some of these delicious polyphenols included in the Mediterranean diet?
I know. I'm like, all the best foods, aren't they? I mean, like, chocolate-covered coffee beans. I mean, they are just best thing on this planet. Yes, so when it comes to red wine, I had a lot of chat with my supervisors about this, because so much research shows that increased alcohol is not good for depression and mental health. And the survey that we did, we asked specifically about alcohol and the effect it has on them and their mental health. And again, the overwhelming majority said that it has a negative impact on their depression symptoms. So I don't really want to be going around encouraging people to drink, particularly if they don't drink. So if they are someone who doesn't drink, then continue not drinking. If there's someone who likes a drink and they don't mind red wine, trying to change it to red wine. And those people that drink a lot, trying to get them to really reduce that, you know, to the guidelines of not over drinking. The guidelines for the Mediterranean diet is, you know, a glass or two with a meal. Most of the young men in my study definitely don't drink red wine with meals at all. You know, it would be beers or spirits or binge drinking and things like that. So the advice we've been given is to sort of try and reduce and cut down. But if you're going to have some, choose red wine and have it with a meal.
Great. And how about coffee?
Oh, and coffee. I love coffee, so let's just get that out of the way. I know a lot of naturopaths are very anti-coffee.
Not the mothers.
Now, a lot of people that have depression also have anxiety. And we know that coffee is not good for anxiety. So again, it's about working with them. In the Mediterranean diet, it doesn't necessarily say anything about coffee, like you have to include it or you have to have a certain amount or anything like that. Generally in the research, it's sort of like, it really varies. It's not very standardized in terms of like, even what it will say is, one serve of coffee can be like, in one study it will be an espresso and another one it's like a milky cappuccino. Like it's not very standardized. It's caffeine and it's all a bit of a mess, to be honest. However, we know that coffee and caffeine can increase serotonin. And I think that was like an old treatment years and years and years ago, back when, depressed people were sent to the seaside for a holiday to treat their depression. Having a coffee was like part of that as well. So it depends on the individual.
Okay.
You don't want to overdo it. You don't want to overdo it. If you don't drink it, don't starve. If you're drinking, more than 4 cups, maybe cut back.
Oh, yeah.
But that nice middle ground of like 1 or 2 is totally fine, provided you don't also have anxiety, you don't also have insomnia or any other kind of issues or issues with cortisol or stress response or anything like that,
Okay, great. Yeah, because I know in Italy they sit there and they drink the little espressos. It's kind of 1 shot of caffeine. There's no milk in it, and it's just, that's it. But in Australia, we have a double shot with a lot of milk in it as well. And obviously we could go into quality of milk versus the quality of milk that's happening in the Mediterranean diet, because, there's going to be all these big factors. Obviously, I'm thinking far too into it as to what the Mediterranean diet has been generalised as. But I guess as naturopaths, this is the stuff we do talk about, is quality versus quantity and stuff too. And there is, the huge associations there with caffeine and anxiety too. So I just wanted to touch on that. But thank you. I'm definitely an advocate for coffee, but moderation is the key.
Definitely agree with you there.
Okay, have you got any book recommendations, maybe even particularly around someone that might be listening to this podcast going, oh, I need to get on board the Mediterranean diet? Where's a good book to start? I know, I forgot his last name, Dan, who's studying the blue zones. He's brought out some amazing books, recipe books in particular too. Are you a fan of him?
Yes, I have his books as well. I've got so many book recommendations for anyone listening.
Great.
And in particular, certain researchers and people in this space who would be great to follow on Instagram and social media and things like that. So I guess my first recommendation, particularly for a book, would be Brain Changer by Professor Felice Jacka. Now, she was someone who led that SMILES study and is the director of the Food and Mood Center at Deakin. And she's amazing. And following her and the Food and Mood Center at Deakin and reading her book would definitely be at the top of my recommendation lists. The Food Mood Connection by Dr. Uma Naidu. Following her on social media and reading her book is pretty brilliant. Her book has a different chapter for different mental health conditions. So, there's a whole chapter on depression, then on anxiety, then on OCD, on insomnia, on libido, all different things to do with nutritional psychiatry. So that would be a really good one to read as well. And then there's another researcher who I follow called Drew Ramsey, and he released a book, I think like 2 days ago, so I haven't read it yet.
Okay.
It's called Eat to Beat Depression and Anxiety, and he's amazing and he does some incredible stuff. He's quite inspiring to watch. I think he's even done a TED Talk and a few other things, so I'm eagerly awaiting his new book to arrive. But I'm sure it'll be full of his usual pearls of wisdom. So there would be just a few. I could probably give you hundreds more, but stick with that.
How about a good TED Talk recommendation?
So I really like a TED Talk by someone called Julia Rockledge, I think is how you say her name, and it's the surprisingly dramatic role of nutrition in mental health. And that's a good one. That's a good 15 minutes, and she kind of goes into everything. So that's a good intro.
Fantastic. And I look forward to your future TED Talk, Jess. I'm sure you'll get there one day. Now, where can our listeners find you? Can we please have your Instagram and any social medias that you share information on?
Yeah, absolutely. So the main one for my research journey and what I'm doing in that space would be Jessica, the researcher. And that's where I sort of share day to day what I'm doing, when I have things published, new things that are coming out in this space. I'm not very good on social media, I'll be honest.
You're a busy woman.
And I'm trying.
It takes time.
Otherwise, if you're a practitioner and you're wanting to really get into like the research papers and things like that, you can find me on ResearchGate if you just search for my name, and that has all of the papers that I have published, as well as conference proceedings, posters I've presented, all of those sort of more academic outputs you can find there.
Okay, great. Jess, thank you so much for taking the time to come and chat about depression, and I'm so inspired by the work you're doing, and I think it's just such a great area. You're making such an impact, especially to those young boys' lives that are suffering with mental health. So, good on you. And I just want to say a big thank you for taking the time out and coming and sharing your wealth of knowledge. And good luck with all your future endeavours in your study and your Ph.D. And I'm following along, and I love watching all your stuff that you publish and you get published. And it's a really exciting time to kind of be in this world of supporting mental health with what's happening today, especially since 2020. It's all blown up now, hasn't it? So I just wanted to say a big good on you, and I love watching your work, and thank you so much for sharing all your knowledge.
Oh, thank you so much. You're right. It's very exciting, watch this space. Thank you so much for having me on. Thank you.
Thanks so much, Jess. Thank you for listening. I have been a practitioner of naturopathic and Chinese medicine for over a decade. I have a master's degree of health science, and I am an academic lecturer at Australia's leading natural medicine college. I am available worldwide online for bookings. Simply go to sandyrosshealth.com.